Welcome back. Let's talk about sleep disorders as they could be part of the respiratory pathophysiology. Before we look at a sleep disorder, what I want to do is to introduce some of the terms such as apnea. Apnea is cessation of breathing, and anytime you're not breathing for 10 seconds or longer, that is referred to as apnea. Insomnia is when a person is not able to sleep, so getting less sleep than normal. Hypersomnia is when a person sleeps a lot longer than usual. Okay, typically it's about 8 hours of sleep. Then if it is too long, too short, that's when you use these terms. Narcolepsy is where a person falls asleep anywhere. So that's where loss of boundaries between wakefulness, REM and non-REM sleep stages. Then another term is parasomnia, again, abnormal sleep, where you could organize this into REM parasomnia and non-REM parasomnia. Okay, so if a person has nightmares in his or her REM sleep, or enacting of dream during REM sleep, those are referred to as REM parasomnia. Okay, so it can be harmful if a person is enacting a dream and then injure herself, himself, or others. Wakefulness during non-REM sleep is called non-REM parasomnia. This is where a person may wake up with confusion or a sleep terror or a sleep acting, that is talking, walking, cooking, eating, that kind of stuff. All right, now we get to talk about obstructive sleep apnea. Okay, look at the term obstructive and the sleep. Okay, apnea during sleep due to some sort of obstruction, and this obstruction is within the respiratory tract, airway. Okay, so that's what you call as obstructive sleep apnea, or OSA. All right, sleep-induced arousal, that means this apnea happens in sleep, relieved during awake period. That means there is no apnea when a person is awake. Okay, so that's obstructive sleep apnea. Okay, so let's look at what happens in a typical sleep. Sleep is when the muscles are relaxed, and that's when the airway gets narrower. Okay, so there may be obstruction of air moving through this narrow airway. Okay, and that's how you have apnea. Okay, difficulty, cessation of breathing because air is not moving in or out because of the narrow airway. Okay, that is because of muscle relaxation that occurs during sleep. Okay, and this is a very common type of sleep disorder. So now we have to look at comorbid conditions that are associated with obstructive sleep apnea. There is a long list: coronary artery disease, hypertension, myocardial ischemia, congestive heart failure, AFib, stroke, type 2 diabetes, NASH, that is non-alcoholic liver disease, polycystic ovarian syndrome, Graves' disease, hypothyroidism, and acromegaly. Now, predisposing factors include family history, genetic inheritance, upper airway narrowing. Obesity happens to be a major one, because think about how an obese person may compress the airway a bit more than a normal person. And then also because of obesity, there may be a buildup of fat in the lining of the airway that could interfere with the flow of air. Okay, male gender, it's more common in the male. And also from the age of menopause, common in women. Think about the function of estrogen, that is the muscle uh, tension, is reduced in the absence of estrogen in a menopausal woman, and again, more relaxation of the muscle, meaning airway narrowing, okay, airway obstruction. Use of sedative drugs that induce sleep would again relax the muscles and airway constriction. Alcohol, especially during in the nighttime, right about the time to go to sleep, could also cause the same thing, muscle relaxation, and then the narrowing of the airway. Cigarette smoking is where you have to think about this toxin affecting the cilia and then the cells, and then inflammation leading to the buildup of fluid within the airway and causing the narrowing. Okay. Now, upper airway obstruction is one cause of OSA, and most commonly retropalatal and retroglossal areas of oropharynx. Glossal refers to tongue, so that is where the position of the tongue, position of the palate, it could be the cause of upper airway obstruction and leading to obstructive sleep apnea. And then other anatomical factors that could affect OSA are craniofacial abnormalities. Say, for example, jaw being smaller than normal, or a tongue being thicker than normal, as in Down syndrome patients. Excess soft tissue deposition could be another cause. Then enlarged tonsils or adenoids, as it's more common in children, but could also affect adults. Acromegaly is where the bone size gets bigger in adults, and that could be in the way of passage of air. And then thyroid enlargement, goiter, could be another cause. Now, respiratory related arousal response. So you may wake up more because of the condition related to respiratory system, that is hypercapnia, that is too much CO2 in the blood, and hypoxia is less oxygen than normal at the tissue. Those are situations that could make a person not be sleeping but be awake. Upper airway obstruction, we already talked about that. And then instability of the ventilatory response to chemical stimuli. Instability of the ventilatory response to chemical stimuli is where chemoreceptors may not be responding as well to these high levels of CO2 or low levels of oxygen, and then the rate of respiration is not corrected, and the buildup of these could cause a person disturb sleep. All right, other details related to pathogenesis, that is apnea and hypopnea. What is hypopnea? This is where the breathing is not terminated, but it is very slow breathing. Okay, diminished breathing is hypopnea. Apnea, cessation of breathing. So these two together could lead to a condition of hypoxia, less oxygen than normal, and then reoxygenation cycle. So whenever a person breathes, then there is oxygen, and then the pause is when there is hypoxia. So these cycles on and off could turn on certain genes called redox sensitive genes. Okay. This is a new name, redox sensitive genes, and now these genes are activated. They then lead to oxidative stress. Think about how hypoxia could be the cause of inflammation. We have talked about how less oxygen means anaerobic respiration, lack of ATP, loss of functions of certain structures within the cell, buildup of lactic acid, causing acidosis and injury to the cell overall, and then oxidative stress. There are intermediate products of various chemical reactions that are turned on in the absence of oxygen. Those would lead to inflammation. Okay. Yet other changes that you would see is activation of the sympathetic system, coagulation cascade, then the alteration in hypothalamic pituitary adrenal function. When you say adrenal function, you should be thinking about the secretion of cortisol, a stress hormone. Okay, this is a stressful situation that could elevate the levels of cortisol. Okay, and all of these, okay, directly or indirectly, could cause endothelial dysfunction. Okay, inflammation causes endothelial dysfunction, and so when there is endothelial dysfunction, there is systemic hypertension. Okay, and then pulmonary hypertension, atherosclerosis, heart diseases like systolic, diastolic dysfunction, coronary artery disease, congestive heart disease, atrial fibrillation, stroke, and sudden cardiac death. All right, so there are a lot of consequences because of poor breathing condition. Okay, so more details related to obstructive sleep apnea, and now arousal episode and chronic sleep deprivation. What you're saying is you're getting up more frequently and getting less sleep. That condition can lead to increased sympathetic activation, decreased parasympathetic activation. Okay, so you already know that a person, when he's awake, sympathetic activation is higher, parasympathetic activation is less, and during sleep time is when parasympathetic activation is greater. And now, because you're waking more frequently, it would tend to increase parasympathetic. It would tend to increase sympathetic activation. It would tend to decrease parasympathetic activation. So you have sympathetic activation that would increase heart rate, that would increase blood pressure. Now that would increase left ventricular afterload, and that would also increase the demand for oxygen. Think about how the heart function is increased, and that demands more myocardial function and more myocardial oxygen demand. This would also result in dysrhythmias, myocardial toxicity, and apoptosis. Okay, chronic sleep deprivation also turns on metabolic activation, increased metabolic activity. So you call that as hypermetabolic state. Okay, so when you have sleep deprivation, when you have arousal episode more frequently, the consequences are increased sympathetic activation that would affect the heart function, and then the metabolic events. Now, more to think about, increased inspiratory efforts. So you're trying to breathe more, large swings in negative intrathoracic pressure. Okay, because of apnea, you're trying to overcome, so it's a negative feedback. So large swings in negative intrathoracic pressure transmitted to heart, lungs, and great vessels. Because they're all local structures, the increased negative intrathoracic pressure may have something to do with coronary artery disease prevalence. All right, and then look at the EEG wave changes. There are these EEG wave changes suggest increased light stages of sleep and decreased deep sleep. All right, and also when you're lacking normal sleep, a person may increase daytime sleep, so may fall asleep randomly, and then also decrease cognitive abilities. Yes, when you don't have enough sleep, that would affect the cognitive ability, so may not be able to uh, function as well with less sleep. It also results in mood disorder. There may be increased incidences of motor vehicle accidents, insulin resistance. Insulin resistance could be related to increased sympathetic activation and increased cortisol levels. Okay, that could lead to type 2 DM, and all of those could be directly, indirectly related to glucose intolerance, dyslipidemia, that is mobility of the lipids from their storage depot, adipose tissue, and leading to obesity and metabolic syndrome. Here is a way to measure the extent of obstructive sleep apnea. So typically AHI refers to basically apnea hypopnea index. Okay, so less than 5 times per hour is considered normal. Okay, 5 to 15 times per hour is mild, 15 to 30 times per hour is moderate, over 30 times per hour is severe. All right, another measurement one can use is neck circumference. Okay, male having 17 inches or greater, a female having a neck circumference of 16 inches or greater is considered to be prone to developing obstructive sleep apnea. Well, now let's switch to central sleep apnea. That is where you're talking about something other than the respiratory system, not associated with respiratory efforts during apnea, but associated with instability of neuron control of respiration. Okay, maybe a neuronal abnormality. The brain, the respiratory centers in the brain are affected, and that is where you're looking at sleep apnea related to the brain, the spinal cord, weakness of respiratory muscles because of the poor control by these respiratory centers. Not to do with the airway abnormality, but due to the respiratory center, respiratory muscle abnormality. All right, now one more, that is sleep-related hypoventilation disorders. Your respiratory rate is affected here, okay? Hypoventilation, and that is related to sleep. So associated with the diseases such as COPD, chronic obstructive pulmonary disease, okay, causing hypoventilation because, difficulty breathing here. And then ALS is amyotrophic disease, amyotrophic sclerosis is how you call it. And that is where ALS is where the nervous system, the neurons are being lost, and that may be affecting the respiratory centers. Obesity, again, affecting sleep, and then neuromuscular disorders affecting the respiratory muscles. Kyphoscoliosis is the body position that would interfere with the normal lung function. Okay, so clinical features of sleep-related hypoventilation disorder includes obesity, somnolence, sleepiness, twitching, cyanosis, and periodic respiration. So that is where less than normal breathing. All right, that's all you want to talk about here. Thank you.